Good evening, guys. This is discussion C for you all. We're going to discuss the palliative care versus hospice care. So I'm going to go through and tell you the difference between the two. Some services are similar, some are different. So we're going to go through those right now for discussion C. So please join me for the discussion tonight. Hope this information helps clear up some people's some confusion that people have. So let me go through that for you, please, and try to clear it up for you. Okay, let me get set up. Okay, palliative care and hospice care are both designed to support individuals with serious illnesses, but they serve different purposes. Okay, here we go. I'm going to discuss, like I said, I'm going to discuss each one, services that we provide and things. Me as an end of life care specialist, I'm going to explain both of those for you, and then we should clear that up for people. Okay, palliative care and hospice care are both designed to support individuals with serious illnesses, but they serve different purposes. Okay, palliative care is available to anyone at any age or any stage of serious illness, even while receiving creative care or creative treatments. It focuses on improving quality of life by maintaining or by managing symptoms and coordinating care. Patients can request a referral from their healthcare provider to begin palliative care. Okay. Hospice care, on the other hand, is specifically for individuals nearing the end of life who are no longer receiving curative treatments. It is provided to those with a life expectancy of 6 months or less. There's a difference, folks. Okay. Hospice care comes in when a person has 6 months or less. Now, that doesn't mean like like if a person doesn't pass away in 6 months, that doesn't mean we're gonna end care with you. That means that hospice care can stay with you until in the end of life process happens. Could be 6 months, could be a year, could be 6 years or longer. It depends on how a person handles that particular illness with their bodies and such, because people are different. Okay, so I'm going to finish this up for you. Palliative care is available to anyone at any stage of serious illness, even while receiving creative treatments. It focuses on improving quality of life by managing symptoms and coordinating care. Patients can request a referral from their healthcare provider to begin palliative care. Hospice care, on the other hand, is specifically for individuals nearing the end of life who are no longer receiving curative treatments. It It is provided to those with a life expectancy of 6 months or less, and prioritizes comfort and support for both the patient and their family. Okay, hold on. I switch. I get paper. First one down. Okay. Now, palliative care is designed to improve quality of life for individuals facing serious illnesses by managing symptoms, providing emotional support, and coordinating care. It can be provided alongside creative treatments and is available in various settings, including hospitals, nursing homes, outpatient clinics, and even at home. Okay, now we're going to go through the key aspects of palliative care. Okay, symptom management helps control pain, nausea, fatigue, and other distressing symptoms. Okay, then you've got emotional and psychological support offers counseling and support for patients and their families. Then you have care coordination. That is palliative care. Palliative care does your care coordinating for you. Okay, so sometimes palliative and hospice care work together. So when we get to that point, I'll explain that also. Okay, care coordination ensures that different healthcare providers work together to meet the patient's needs. Okay, advanced care planning helps patients make informed decisions about their treatments and further care. Spiritual support provides guidance based on personal beliefs and values. Symptom management in palliative care focuses on improving the quality of life for individuals with serious illnesses. By addressing physical, emotional, and psychological discomfort. Key aspects of symptom management: pain relief, opiates like morphine are commonly used to manage pain, ensuring comfort. Now, both services can use morphine for comfort. Both services do use the same medication for comfort, so that stays the same for each one. Okay. Give me 2 seconds, guys. Okay. Second part of this is breathlessness control. Medications and breathing techniques help ease respiratory distress. Nausea and vomiting management. Anti emetics are prescribed based on the underlying cause. that is anti-vomiting medication. Okay. Fatigue and weakness, energy conservation strategies, and tailored exercise plans can help. Okay. And then next thing is anxiety and depression support, counseling, medications, and relaxation techniques provide relief. Okay. Now the next part is when a person is getting toward like needing extra pain control and things. I'm going to explain what happens. Delirium and agitation. Now patients get aggravated. When the process starts, people get very agitated. So what we do for care is that we give them medications to help control that, or we use deep breathing exercises or natural remedies to help them through that process. Okay. Let's see. Identifying reversible causes and using medications like Haldol can be effective. And then you go down. Would you like more details on specific symptoms or treatment approaches? Now, for this one, I've got a couple more for you. So give me a minute to finish this, please. Okay. Let's straighten this out. Palliative care focuses on relieving symptoms associated with serious illnesses to improve patient quality of life. Some of the most commonly managed symptoms include pain, often treated with opioids or other pain-relieving meds, breathless, that's dysphagia, managed with oxygen therapy, medications, and breathing techniques. Nausea and vomiting. Antiemetics are prescribed based on the underlying cause. Fatigue and weakness. Energy conservation strategies and tailored exercise plans can help with that. Okay. Last one, guys, is anxiety and depression counseling. Anxiety and depression counseling. Counseling or anxiety and depression. Counseling, medications, and relaxation techniques provide relief. Okay, then you've got delirium and agitation. Like I said, identifying reversible causes and using medications like Haldol can help be effective. Okay, then you've got constipation, often caused by opioids use, managed with laxatives and dietary adjustments. Okay, then you've got this is when somebody gets near the end of life process. It's called the death rattle. It's when somebody's dying. So I'm going to explain that to you too. Anticoagulant medications can help reduce excessive secretion. Okay. Then the question here, guys, is would you like more details on how these symptoms are treated or how to access palliative care services? Okay, I thought that would be a good one to do tonight, so I hope this helps somebody, and I will see everybody for D in a little bit. For now, Gator Wellness, take care, folks.